We're basing DTR on the data from the T-scan and the EMG. We're confirming that the muscle is chilling.
Right.
Let the muscle take the mandible where it needs to go.
Right.
And let the body heal to that stable and adapt. It's not stable and adapted yet, but we're, in your case, because you're beyond where we normally go, but we're trying to make it to where it will become stable and adapted over time. Letting the muscle simply pull the jaw up to a place that we hope will adapt.
Right.
Sounds like your left side's working.
Yeah, man.
Your left side is cool,
I don't
right?
feel
So
like I don't have TMD over there.
Right. Now, so then that happened in 3 days. What brings you here?
A lot of pain in the TMJ joints.
Many people will tell you it's psychology.
Yeah, they'll tell you it's in your head and this, that, and the other. But what they can't tell you is, why is your face so swollen? Why can't you open up your jaw? Why, when you do open your jaw, it's constantly clicking? Why can your friends chew gum as long as they want, but you can only chew it for a couple of minutes? Why is your vision blurry when you used to have 20/20 vision? You know, why did you always have a very high IQ and school came so easily to you, and now it's hard for you to write a simple email, and your grades are declining to the point where you have to switch majors? You were once a very social person, and now basically all you can think about is pain, pain, pain. Pain shrinks your world. That's literally all you can think about. That's all you can talk about. And you literally do anything to get out of that pain.
Do you get headaches, for example? Like, what are your main symptoms?
My main symptoms all started literally the day I put braces on, and they gradually increased in severity.
Yeah.
The actual symptoms that I had also increased. So you're basically starting out with blurred vision, headaches, pressure building in the ear, ringing in the ear, teeth knocking together. Your teeth used to fit together perfectly. Now they're, you're always searching for a bite, and basically the symptoms progress to more severe headaches that are basically lasting longer, and they're increasing in severity, and then I don't care who you are, if you're in pain all day and nothing's working to alleviate that pain, pain causes depression, pain causes anxiety, and pain causes poor concentration, and basically it's changing your personality. So I mean, literally this one thing that up until recently no one in the medical community, even to this day, really acknowledges as a true medical diagnosis. It can be very, very difficult to deal with, because it's not like insurance companies are just saying, oh, this is a real thing, yeah, we'll definitely help you out with this.
Good luck with that.
Good luck. Yeah. And then you see the oral surgeons, and they're going to want to do some exploratory surgeries, and your options are basically total joint replacement, or total joint replacement. Extremely invasive surgery with no guarantee of relief.
How are the headaches?
Literally, over here, it's like, what's TMD? Like, it's
no problem
at all. Over here, like my eyes still have like a headache over here, pressure over here. It's like just minutely less. It's so
it was bilateral.
It was bilateral.
And symmetrical, and now it's unilateral, right-sided, which is the bad joint.
Yes.
The one that we know is really messed up. Yeah. How's the earness? The
over
fullness
here?
in the ear.
That went away.
Left side.
Remember, it was still doing it, but slowly.
Yeah.
It
now
doesn't
it's gone.
full. It doesn't get full at all. I could hear everything over here. Here, full.
Okay.
Still have to release this like every every 10 seconds or so.
Oh, so it's kind of like it was.
It's kind of like it was.
Shit.
That's what's so upsetting. It's like, damn, this thing really works. You know?
It works
it
on
works,
us. It works if a joint is relatively stable and adapted.
Damn.
That right side is so messed up. That's what's got me a little freaked. Well, I mean, we knew.
We knew.
But left side's working. We've got at least half it, but we're going to look at the data now. We're going to quit saying how it feels. All this subjective rigamaroo or hocus
You can
pocus.
see we could be back here all day. Like, literally, it's like, what are the patients?
I had a guy who drove in a couple weeks ago from St. Louis, next door an hour ago. You probably saw him when he came in. He's leaving. And he looked at me and he hadn't seen me. And he goes, I saw your latest videos. That was so cool.
Oh, that's awesome.
And I'm like, he's like,
The videos are
how's he
everything.
doing? Because, you know, there's only part 1, part 2. There's no part 3 yet. I'm like, I don't know. I'm going to find out in an hour.
It's a big deal.
It's a reality show, just like we were saying.
You never
No,
know.
you're famous. I mean, he all of a sudden he's like, he goes, I thought I had it bad.
It's a big deal.
Yeah. Bite home really hard. Go to the right and open. Or bite home. It looks good. Now come off to the left. Oh, that's to the right. Come to this.
Oh, left?
Yeah, there you go. It's alright. Premolar touch your canine. I can live with that. Now bite home. Yeah, dude. This guy is not stable.
You feel it changing every
I
time.
know. Is this sore?
Ah,
It is or it's not?
it,
How's this guy?
no.
He's not bad at all, is he? Yeah. So here's an example of a case where we've got
Really don't know what to
two
do.
we've got, no, we do.
Be honest.
We do. We've got two messed up joints. We've got one that's really messed up, right side. We've got one that's not so messed up, left side. Even though he's further than I normally go with DTR. Left side responded, right side is not responding predictably. That doesn't mean it's the end of the world yet. In time, maybe things will settle. I'm trying to give you hope. It's not false hope. I mean, I still think there's a chance. But I still say you need to go get the current MRI and go see that guy. See that one point between 2 and 3? I want him gone. He's only there for about 6 microseconds. Here, bite on that. All right, bite on hard to the left. Okay. Leave it. Don't touch it anymore. Leave it alone. Point 3 and
That's what
point
the data
4.
says.
Get him scheduled with Piper.
Scan doesn't lie.
No, it doesn't. Yeah, you know what? Yeah, man, those are good readings. The resting is healthy. But now versus then, you were weak as a kitten. And now you're like, you know, like a pit bull, like you're supposed to. You can bite. Probably not going to see much of a change, but what's interesting is to see.
I can just borrow some cartilage from each of you. I promise I'll give it back. I swear.
I know,
like,
right? Yeah, part 2, I almost regret the way I did it because I basically said you passed out. Oh, but you did.
Yeah.
You did.
Florida's gonna be like, what drugs does he got?
No drugs. You don't need to do that. And if nothing else, yours shows the absolute limits of DTR.
Yeah, that's what I took from it.
Yep. That's the limit.
If nothing else.
Yep. Look, you don't want to wear NTIs long term. You know that.
Mm.
But if you've got a bad day going on, you know.
This is like the weirdest thing.
So when you wear that splint, it's all good.
I don't feel anything.
Feels awesome.
It's like instant. It's like the weirdest thing.
Now take it out for me if you would. Now bite and grind around. Do you feel it?
Pain.
Where?
Mm,
Just there.
Just an edge.
But that other side, he's cool.
All the time.
And that's new since...
This is new. Since
Okay.
this.
Good. You're the best place I can put you.
Yeah,
I mean,
I feel
seriously.
it now. Like that polish, like I'm more even, like today. And damn it, that's what I was telling you yesterday. I wish I didn't understand that because the data does not lie
That didn't lie.
at all.
Yeah, there's no subjectivity.
Yeah.
I mean, there's a little bit.
A little bit, but I mean, this
It's-
is the most. I mean,
Yeah, I mean, it is what it is. I mean, it's fact. It's quantifiable.
yes.
And we look to get in muscle.
We're
And
high.
Your muscles.
We're up there.
Your muscles are profoundly better than when you walked in. You're able to fire harder. They were completely wore out because they were bracing.
Right.
Either they were bracing mandible, teeth, the way the bite was, or they were bracing because of joint.
Right.
But regardless, the muscles are now a little more symmetrical. They're like pretty normal.
It's a big deal.
It's the joint itself on your right side.
Yeah.
It's big trouble. Now, it's possible, I hope not, but it's possible that even though your left doesn't hurt, it needs attention too. Because it's not in a great place. But based on the joint vibration, you're in a better place than you were.
We're coming from a place where, you know, Tampa, St. Pete, Gainesville, you know,
That's the occlusion mecca.
That's yeah. But it's just when you meet these guys, it's like I don't trust you, you know. So to come here and to meet a doctor that's so straightforward, that's that you could trust, and then you're saying that you could trust this guy. It's if we did nothing,
Yeah. If I were
that's
you,
huge.
I told you who to go to. You said the name.
Yeah.
That's where I would go if I were you, and I would do exactly what I just said.
Oh,
Let him
yeah.
image you in the next month.
Mm-hmm.
That way you will have had time to hopefully adapt.
Oh,
If
for
we're really
sure.
lucky, you're just going to get an MRI, and you're going to be like, we're going to watch this for a while, and you're going to be weaning yourself off the NTIs, and you're going to go through life without any kind of surgery.
Yeah.
If you're not so lucky, he's going to go in there and he's going to do surgery on the right side. If you're really not lucky, he's going to do surgery on both sides. But it's not. I doubt he'll do a joint replacement. He'll probably do a fat graft, which is much less invasive and much more predictable.
Oh man, I
So-
mean, I would literally, do everything I can before I do a joint replacement.
Don't do it.
I mean,
My advice is not to do it.
Yeah.
I mean, I that's not what I do. I should. I'm not an authority, so don't take that totally
But-
seriously. But go see Piper.
Yeah, I'm gonna see Piper.
I-
I'm actually
I
gonna go
trust
to the
her.
front, and I'm gonna let you guys help me with that appointment for sure.
Yeah.
Because
His perspective is totally keyed in on the joints themselves, and I know this is a joint issue. I know that we've helped you some, but this is beyond what DTR can do, for sure.
and that's proven. That's proven.
But you're half better with the left side. That is pretty cool.
Yeah, and that proves exactly.
Hey, it might have
what-
meant the difference between, hey, I get surgery on both sides or just one
Or
side.
just one side, right?
So
I mean, that's a big deal to me, man. I mean, I couldn't be happier, So I'm gonna definitely see Piper, and you said you're gonna go? You'll be there in January?
I'm going to see him. I'm going to take his MRI interpretation
Okay.
course. There's probably going to be a bunch of radiologists and a couple of dentists in there. And I'll be
Okay.
one. So he and I will go talking about this.
Yeah.
I guarantee you this will be an interesting